teleprompter.
Ready? Thumbs up. Ready to go.
Yep. The teleprompter's off though. Okay, welcome everyone. So my name is Martin Boucher. I'm the Executive Director of the Northern Initiative for Social Action. We're a peer-led mental health organization in the community. So again, welcome to our space. NISA started over 20 years ago by a dozen individuals and one occupational therapist who recognized a significant service gap following deinstitutionalization. People with mental health challenges and illnesses living in the community didn't have access to the services they needed to thrive, and they had to initiate them for themselves. Today, NISA provides a variety of mental health services and programs for over 800 members. We offer peer support by phone and both one-on-one and group support on-site, off-site. We offer skills-based programming, including computer refurbishing, quilt making, volunteering, research opportunities. We also foster recovery through the arts by holding writing groups, a member art space, public shows, numerous creative expression workshops, among other programs. All of these are aimed at breaking isolation, developing skills and strategies for staying well, and fostering a sense of community so that people can find the purpose and support they need to grow. Like many not-for-profit service organizations, the pandemic has come with a unique set of unforeseeable challenges. This has impacted our budget, but more importantly, it's impacted how much support our staff can provide and to whom. Today's announcement will help mitigate some of those challenges and help us improve virtual service delivery for vulnerable individuals who are at home. And for those that can come through our doors, it'll help us receive them safely by ensuring that we have the funds to provide the PPE and cleaning supplies that our staff needs. Without further ado, it's my great pleasure to introduce the Premier of Ontario, Doug Ford, to make an exciting announcement. Miigwech, thank you, merci.
Well, first of all, thank you, Marty, and good afternoon, everyone. It's great to be here in Sudbury, the city of the Big Nickel. I love coming up north. I always meet the friendliest people up here. And thank you to Marty for the warm welcome. This organization is doing incredible work in this community, and I'm excited to be joining you with our all-star team. Our mental health champion, Minister Tibollo, our champion for the North, Minister Rickford. I always want to recognize Mayor Bigger, and Mayor, what great leadership. Mayor, I want to thank you for your leadership through this pandemic, for your hard work to reopen your community safely. And by the way, folks, there's no cases in Sudbury, so it's great to the people of Sudbury and to the leadership of the mayor. Our government is committed to ensuring every part of Ontario can get back on track. That's why we held our first ever summit yesterday with Quebec Premier Legault and his key ministers. We discussed ways to work together to secure more funding for healthcare, infrastructure, and broadband expansion. These are all essential pieces that will contribute to our economic recovery and improving the quality of life. And improving our quality of life is why we continue to make critical investments in great communities like Sudbury. We delivered a new PET CT scanner for Health Sciences North last year. We're investing over $33 million in transit projects, including purchasing 53 new buses for the city and building 3 new transit hubs and bus rapid transit lines. And we're providing $12.6 million through the Federal Safe Restart Agreement to support frontline municipal services. Well, we continue to make investments in frontline healthcare to the tune of an additional $7.7 billion to support the fight against COVID-19. We know this virus has had a wider impact. It shows itself through isolation, through burnout, through depression and anxiety. Our frontline workers are not immune to it. Our young people are not immune to it. Whether you work in a hospital in downtown Toronto or a long-term care home in Sudbury or live in a fly-in community in the far north, I want all Ontarians to know that your mental health is as important as your physical health. Just as we've always put your physical health and safety first, we have your back when it comes to mental wellness. It's why we invested $12 million to immediately expand online and virtual mental health supports for everyone who has been self-isolating, for those in the trenches, our first responders, and frontline healthcare workers, for our young people. We wanted to let them know that they are not alone. We're here to support them. And that's still the case. And I'm proud to announce today our government is investing an additional $14.75 million to further expand access to mental health and addiction services. This money will go towards safely resuming in-person counseling services, virtual services, and providing care in congregate settings. This investment also includes specialized services for Indigenous communities focused on supporting our Indigenous youth and children. Again, if you need to talk to someone at any time, please, and don't hesitate, please reach out. We're funding incredible organizations who are ready to help. Kids Help Phone, Good to Talk for post-secondary students, Bounce Back for adults and youth, and so many others. These people are the best of the best. They're caring, compassionate, knowledgeable, and ready to help. So again, if you or a loved one is struggling right now, please go online or pick up the phone. It can make all the difference in the world. Thank you, and God bless the people of Ontario. Now I'll hand it over to Minister Tibollo.
Thank you, Premier. The stress and anxiety so many Ontarians have experienced throughout the COVID-19 pandemic have been difficult and complex. We want Ontarians who need that extra help to have access to the high-quality supports they deserve. It's clear that COVID-19 has presented us with many new healthcare challenges. Since the start of the outbreak, Ontario has been a world leader in COVID-19 research. We've been instrumental in assisting the global fight against this deadly virus. And that's why I'm proud to announce that we are also investing over $2.9 million to fund 8 research projects submitted through the Ontario Together portal. This is on top of the amazing work already being done through the government's $20 million Ontario COVID-19 Rapid Research Fund. These research projects will focus on mental health, ventilation, imaging, and transmission to support Ontario's response to preventing, detecting, and treating COVID-19. C'est pourquoi je suis fier d'annoncer que nous investissons également plus de 2,9 millions de dollars pour financer 8 projets de recherche soumis via le portail Ontario Together. Ces projets de recherche seront axés sur la santé mentale, la ventilation, l'imagerie et la transmission de soutenir la réponse de l'Ontario à la prévention, à la détection et au traitement de COVID-19. With this investment, researchers in Ontario's world-class post-secondary and healthcare institutions will soon be conducting extensive research that will help to inform us on how we can better support Ontarians during an outbreak of this current magnitude. From assessing the impact COVID-19 has had on children's daily lives and psychological distress, to researching how we can better treat COVID-19 survivors living with lung damage and respiratory failure, these groundbreaking research projects will help save lives, not just in Ontario, but around the world. We recognize the long road to recovery that lies ahead for all of us. As the COVID-19 pandemic evolves, we will also evolve our approach and support for those in need. We will continue working across sectors and identify opportunities to support innovative services, ensuring Ontarians receive the high-quality care they expect and deserve. Thank you. Merci. Miigwech. I'd now like to pass it to Minister Rickford. Thank you.
Well, thank you, Minister Tibollo, and Premier. Thank you for being here in beautiful Sudbury. Good afternoon, everyone. It's a pleasure to be here today. À titre de ministre de l'Énergie, du Développement du Nord et des Mines et ministre des Affaires autochtones, ma passion est de veiller à ce que les collectivités du Nord rural et autochtones de l'Ontario prospèrent et s'épanouissent. Cela veut dire aider nos collectivités à se remettre sur la bonne voie, tandis que nous apprenons à vivre avec la réalité de la COVID-19. We know that COVID-19 pandemic has increased the need for mental health and addiction services as every Ontarian navigates the new normal. That's why I'm proud that today's funding announcement will help meet this growing need by increasing access to community-based mental health and addictions treatment in Northern Ontario. I'm also pleased that up to $4.75 million of this funding is earmarked to support specialized and culturally responsive services for Indigenous communities, with $750,000 dedicated to supporting Indigenous youth and children. Northerners know it best. When healthcare and mental health services are available closer to home, Northern communities and families can thrive. That's why I was also pleased to be up in Moosonee yesterday to be with my friends from Moose Factory Island to announce our government's investment in the redevelopment of a new hospital campus that will bring culturally appropriate mental health and addiction services to the region. In fact, this will be a full suite of infrastructure, health services, and programs not only long overdue, but to serve that region and allow many people to stay in their homes for various kinds of treatment. So whether you're living in a northern city, an unorganized territory, an isolated community, all Ontarians need and deserve access to high quality care. And we're proud to deliver that to Northerners today. En tant que ministre responsable du Nord, je m'engage à bâtir des collectivités fortes et résilientes dans chacune des régions du Nord de l'Ontario. Je veux que le monde sache que le Nord de l'Ontario est un endroit attrayant où vivre, travailler et investir. Grâce aux engagements financiers comme celui aujourd'hui, nous renforçons nos collectivités et nous améliorons la qualité de vie pour les gens du Nord. Thank you again, Minister Tibollo and Premier, your worship. It's great to see you. Your steadfast leadership, Premier, and the commitment to the health and safety and well-being of people in every region of Ontario, and especially and including for the purposes of today, Northern Ontario. Thank you. Merci. It's now my pleasure to invite to the podium the Mayor of Sudbury, Mayor Brian Bigger. Thank you.
Well, hello everyone. Bonjour, Ani. I'd like to extend my thanks to Premier Ford, Minister Tibollo, and Rickford for coming here to Sudbury today. And before I begin, I'd like to start off by first acknowledging that we're on the territorial lands of the Robinson-Huron Treaty. These lands are traditionally shared by the Indigenous people of the Atikameksheng, Anishinaabeg, and Wahnapitae First Nations. This is a very important announcement, not just for Greater Sudbury, but one that will have a positive impact province-wide. With the $14.75 million announced today, we're certain that our local mental health agencies and the hardworking and tremendous staff and professionals who go to work every day to make our children, our youth, our families more healthy and safe will see immediate benefit from today's news. The last 6 months have really showed how important the continuity of mental health care is, and whether that's in person, one-on-one, or online. And this new funding will help our region, Northern Ontario, overcome the issues like geography and distance that can so often deter those who need this important care from receiving it. As Mayor of Greater Sudbury, I'm inspired by how all three levels of government have been able to work together so effectively as we're all facing the enormous pressures of COVID-19. Our finances, our resources, and the very people we are all elected to represent. When it comes down to it, it's about being a leader and not a politician. We're all seeing that during this hard and unpredictable time. Premier Ford, I thank you again for coming today to allowing Greater Sudbury to play an important part in this important announcement. And I look forward to a return visit very soon when things get back to normal. Thank you very much. Megwich, merci.
Great.
Okay, we'll go to
Thank you, Mayor.
We'll go to the phone line for questions. First question, please.
Your first question comes from Matt Derman with Sudbury.com. Please go ahead.
Hi, Matt. How you doing?
Good afternoon, Premier. We've got an FAO report here that states that Doug Ford is sitting on $6.7 billion in unallocated COVID-19 fighting funds. The question is, why is this money being sat on? Why is it not currently being used?
Well, we're flowing it as quickly as possible, and I'll be able to get the exact figures, because as soon as we get it, we start flowing the funds, and I'll get an answer for you. I don't have the exact answer because I haven't seen that. I guess it came out this morning, but I've told each ministry, as soon as you get those funds, you start flowing it right to the people that need it most.
Follow up.
Now, with the dip in COVID-19 cases in August, we're now starting to see numbers creep back up to peaking towards 200. Is the province prepared to start scaling things back or moving back into regional reopenings across the province?
Well, Matt, I'm going to take the advice of our chief medical officer, which also consults with our health team, which consults with the 34 other chief medical officers. But you know, Matt, I'm first of all, I'm proud of everyone in Ontario. They're doing a great job. I'm very grateful for the mayor doing a great job, and all the people here in Sudbury. We have 14 regions that have 0 cases of COVID. We have 14 other regions that have 5 or less. And then we have the same big urban centers, no matter if it's Peel, Toronto, Ottawa, here York, and now a few in Durham. So if you take those out, we're doing very well as a province, but we have to keep our eye on the ball constantly. And once it gets to a certain point, the chief medical officer of Ontario, Dr. Williams, will be advising us the next step. But right now, we're keeping an eye on the ball. I just ask people out there in those large regions, guys, avoid parties, because what I'm hearing, Matt, it's not coming from bars, it's not coming from restaurants, it's coming from large gatherings, be it weddings or parties or wherever. But we have to be vigilant. We can't let our guard down for a second.
Next question.
Your next question comes from Jean-Luc Deschard with the Radio Canada. Please go ahead.
Hi,
Yes,
John.
good morning, Premier. My question is that while the Sudbury Community Drug Strategy published a study this summer recommending the establishment of the first supervised injection site in Sudbury, which ties into, the mental health and addiction services you've announced today, will your government approve this project now that the study has been completed?
Yes, I'm going to hand this over to Minister Tibollo. Thank you.
Thank you. The government supports the creation of consumption and treatment sites, and funds are available for communities that request them. So if an application has been made and submitted, it will be looked at, and there are funds available to be able to establish them. It is obviously an important part of accessing the system. But again, our concern is making sure that we provide treatment and support services for all individuals in need. And this is a great way to have an access point to be able to continue to provide those services.
Follow up.
Thank you. And my second question is on the Sudbury Hospital, which had to cancel all surgeries this week because of overcapacity caused by a backlog in long-term care homes admissions, according to the hospital CEO. Would you consider, relaxing admissions criteria in long-term care homes in order to relieve pressure on the hospital, like considering, like you mentioned, Sudbury has no active cases right now?
Yeah. So we have over 180,000 backlog cases with surgeries. We're working with the Minister of Health and our health table to see if we can open up a lot of these surgery rooms. We have funding to ask the docs, and they've been fabulous. So the nurses and the hospitals to open up surgeries, start working on Saturdays, Sundays to get rid of the backlog. So the funds are there. We'll support them, and we're just working with each and every region.
Next question.
Your next question comes from Robert Benty with the Toronto Star. Please go ahead.
Hi, Robert.
Hi, Premier. Yesterday you said that you wanted to speak with Energy Minister Greg Rickford about the unconstitutional gas pump stickers. I take it you probably have had a chance to talk to the minister, being that he's standing there with you in Sudbury. Just wondering, have you guys come to a decision yet about abandoning any appeal. I mean, the ruling is pretty pointed. I mean, I'm not a legal expert, but it doesn't sound to me like it would be something you could easily overturn at a higher court.
Yeah, well, I respect the courts. I'll pass it over to Minister Rickford.
Thank you, and good morning, good afternoon, Robert. Look, we respect the court's decision. We don't agree with it to the extent that we believe the people of Ontario need to understand where additional costs are coming, especially at the point of purchase with respect to gasoline. We appreciate that up in Northern Ontario, perhaps more than most. Our schools buses travel longer distances, our sports teams, our hospitals incur greater expenses, and we have documentation to support that this has put additional costs. So we understand its importance, and we respect the court's decision, but we think Ontarians deserve to know where those additional costs are coming.
Follow-up.
Yeah, on another subject, for the Premier, on Monday, the House resumed, and I'm just wondering if he can look ahead to what the government's agenda is going to be for the fall and what he expects to see and what the tone will be like in the legislature. I mean, I know they sat in the summer, and at times it was respectful, but at other times it got more heated. You guys are headed back to the House on Monday. Most kids will be in school next week across the province. I'm just wondering, what do you think the scene will be like in the legislature? What is the government hoping to achieve? And what do you think the tone will be like?
Well, I hope the tone with the opposition is collaborative, and we've been collaborative. I don't care what color of party you're from, green, orange, red or blue. We need to work together, and that's what our goal is, to work together, work collaboratively with all parties, and that's the reason, Robert, we've been able to get through this COVID and have the lowest numbers in North America for a large region like ourselves. And I just hope they don't play politics. I don't have time for politics. I want to help the people. And we're going to have a good, heavy agenda moving forward. And I'll make sure that Minister Calandra reaches out to you and gives you a lineup of what we're looking to do. But again, we all need to work together. It doesn't matter what political stripe you're from. People expect us to work together. It's as simple as that. And that's what we've been doing. So hopefully they'll cooperate. You never know.
Next question.
Your next question comes from Sabrina Nanji with Queen's Park Today. Please go ahead.
Hi, Sabrina. Sabrina?
Sabrina, you may have to unmute.
Hello? Sorry.
Hi,
Hello,
Sabrina.
Can you hear me?
Yeah, I can hear you now.
Sorry about that. Premier, I just wanted to follow up on something you said earlier about, you're seeing the uptick being related more to large gatherings. So does that mean that you'll first consider, rolling back the restrictions on the 50-person and 100-person limit? Is that something that you would look at first?
Well, something, we just aren't there yet. And I'm going to take my advice off Dr. Williams and our medical team before we make any decision. But we aren't there. We saw another spike today. I think it was 170, which is always concerning. Then yesterday it was 140. But again, put it into perspective. There's 4 large regions that the numbers are higher than what we'd like to see. And if we can get those 4 regions in hand, then we should be fairly good. But again, I practice the golden rules. Wear face masks, wash your hands, sanitize your hands, and practice social distancing. And then we're good to go. So I'll help the regions any way I can to help them get through it.
Follow up.
And yet this week, you've also been talking about, problems with police being able to enforce the Quarantine Act and, investigate those violations.
Yeah.
So Alberta has its own hotline where people can call in and, report these cases. Is that something that you're considering introducing in Ontario, or do you think that's a good idea?
Well, that's Alberta, and I wish them all the best out there. I'll be talking to Premier Kenney today, asking him how it's working, but very simple. If you know someone's breaking the Quarantine Act, then they should be calling the police. So again, I'll just run through it really quickly. There's, there was 623 offenses. Now that is jumped up to 17 as of this morning, I believe, and it changes every day, but 17 charges. Guys, the system's broken. You can't have 623. There's actually 4,800 in total that they checked on. 622 they felt broke the rules, and 17 got charged. So, you know, I got to work with the feds, because what happens, it has to go up to the federal government, to one of their officers up there, and then they say yay or nay. But you know, we can't have our police running around and seeing people breaking quarantine and nothing happens to them, a slap on the wrist. It turns into be a joke. So I'm going to work with the federal government, and we'll get that turned around. And I just want to thank our police for doing some great work. And all we're trying to do is protect all the communities. That's it. Just follow the Quarantine Act. If you're coming back from a foreign country, just hang in there for 2 weeks, and everything will be good.
Okay, last question.
Your final question comes from Sean Jeffords with the Canadian Press.
Hi,
Please
Sean.
go ahead.
Good afternoon, Premier.
Hi, Sean.
Wanted to follow up on your comments there about the Quarantine Act. I understand you're being somewhat critical of the federal government here. You're saying the system is broken, but isn't the issue here actually police laying tickets on the ground, and why aren't they issuing more of these tickets?
Well, it's actually, Sean, it's a federal quarantine order, and the rules are, and I ran through them again this morning just to make sure I was clear on it, that say an officer goes out and someone's not there, they call up and they aren't home, and they show up to their door and they're gone. And then from there, they send that information over to a federal quarantine officer, and then the officer decides if the charges should be laid or not. So that's, you know, come on, that's just too much red tape. And I'm not being critical of the federal government. Actually, I'm very supportive of the federal government. And there's always little things, no matter if it's municipal or even provincial or federal. There's little tweaks that we have to do, and they're working very well with us, the federal government, and we'll get it fixed. All we're trying to do is, you know, you can't have people going out there breaking the Federal Quarantine Act and then not being held accountable. It's not like they're going to be thrown in jail or something, but they should get a fine. You can't just say slap on the wrist. Okay, guys, don't worry about it, because if you do it again, we'll slap you on the wrist again. Doesn't make sense, and it's not a knock against the feds. I get along quite well with the feds. I'll be talking to them today and tomorrow, so I'll mention that on our call today and see how we can resolve it. It's all about working together, all three levels of government, and everyone's been doing a great job, in my opinion.
Follow up.
On another subject, earlier this week, Minister Elliott announced that pause on the loosening of any further public health restrictions. Do you think that it will be feasible for families to gather for Thanksgiving next month, for children to go trick-or-treating at Halloween, given that pause has been put in place, and that it could very well still remain in place in and around Thanksgiving and Halloween?
Well, we got to be so careful, and that's a month and a half away, Halloween, and you know, we got to take care of the kids. That's a priority. That makes me nervous. A month and a half is a long time when it comes to COVID. You look back a month and a half ago, and even a few weeks ago, we're below 100, and all of a sudden it spiked up to almost double. So let's play it by ear and see what happens over the next month and the next month and a half for Halloween. But just makes me nervous. Kids going door to door with us. I prefer not to. It'd be a shame to, you know. But that we'll check that out, and we're going to advise through our public health team.
Okay, thank you, everyone.
That's great. Thank you so much, and I thank the people from Sudbury. You guys are absolute champions. I love all of you. You're great. Thank you.
Thank you.